we have a graphic actually that we're going to show a little bit more about lifestyle and modification. Of course, the first one there, stop smoking. Thank God we're seeing less and less smokers every day, but that's essential. Let's talk about some of the other things there. How about check cholesterol and other lab work? What are some of the other labs that you commonly do to evaluate a patient with hypertension that they can implement here?
So it is important whenever you have a patient with hypertension, assess other cardiovascular risk factors.
Correct.
So you already mentioned smoking, of course, is a well-known cardiovascular risk factor.
Correct.
But that's something that we cannot control. It's up to the patient.
Right.
Checking if there's diabetes.
Correct.
Okay, because same as a hypertension, sometimes patients could be diabetic without knowing it.
Correct.
So that's a very important cardiovascular risk factor. So that's why we need to check presence of it. Also the cholesterol.
Exactly.
So when we have, it's important for, and that's the primary cares, they usually check the lipid panel. So that helps us to assess what is the true cardiovascular risk for that patient.
Exactly. One of the other things that also I think is important is trying to generate consistency. How important is it for our patients to try to do things and understand that the long haul is what we're trying to help? Is that important for you to help explain to them as well?
Absolutely. I mean, that's the key of everything, basically. And that's why I'm not so strict when I first encounter a patient, because I know how difficult it is, for example, for them to stick to a diet, to stick to an exercise regimen.
Exactly.
So what I always advise them is to start slowly. I mean, they should know what are the healthy things, you know, that they should eat, and also what are the things that they should avoid. So start with that instead of starting cutting calories like crazy, because it's very hard to stick to a very strict diet. Something that they enjoy. Same thing with exercise. Something to pick an exercise that they know that they're going to enjoy, and don't start like pushing them. I mean, they should not push themselves too much to the point that they're so exhausted that they would not like to continue with it. So I think that's very important. And motivation, having the family too, like it's a change for the whole family, that also helps a lot.
Correct.